Hi everyone, Tim here from Active Podiatry. I hope you're all well. So in this short series of videos I'm going to talk to you about calf muscle injury. And by calf muscle injury I'm talking about excessive strain to the calf muscles. Now in this first video I'm going to be talking about the calf muscles themselves, what they are and what they do, and some of the causes or risk factors for injury to that muscle group. In subsequent videos we'll be talking about the symptoms and what you can do about it, some of the ways that you can prevent it. So let's crack on. So first of all, the calf muscles. So when I talk about the calf muscles, I'm talking about the calf muscle complex, which consists of three calf muscles really at the back of the leg. I'm really focusing on the two main ones in this series of videos, though, the gastrocnemius and the soleus. Now, the gastrocnemius is a longer name. There's a bigger muscle. It's one way of remembering it, and that originates at the just above the knee, so it crosses the knee joint, comes down the back of the leg, and attaches via the Achilles tendon into the back of the heel, or the calcaneus. Now that's the bigger muscle of the two. It's the one when you look at the back of your leg and you look at your calf. That's the one you're looking at. It actually has sort of two muscle bellies that you can also see, if you flex your foot down. So that's the gastrocnemius, crosses the knee joint, crosses the ankle joint, attaches via the Achilles tendon into the heel. Now behind the gastrocnemius you have a shorter calf muscle, short and flat. It looks a bit like a Dover sole, and it's called the soleus, probably for that reason. So it looks a bit like a flat fish. Now that shorter calf muscle starts below the knee, but it also attaches via the Achilles tendon into the back of the heel. Now both calf muscles are very important. Essentially what they do is when they contract, the Achilles tendon pulls the heel up, which flexes the foot down. In this foot the tibia doesn't move very well, but essentially the foot flexes down, so when you're pushing off the ground your calf muscles contract and off you go. But they also act as a dynamic stabilizer, so when your foot hits the ground, as your heel starts to drop to the floor, and the calf muscles are eccentrically loading to ease that transition, so you don't slam down hard on your heel. So they function in a propulsive way, but also as a dynamic stabilizer. Now, in terms of running, the shorter calf muscle, the soleus, is often forgotten in rehab and in stretching and what have you. But the soleus is responsible for carrying a disproportionate amount of load for its size. It's a very important muscle in runners, and it's quite common for that one to be injured. And of course, because it sits behind the gastrocnemius there, it can be hard to access. But it's very important to bear that in mind as we go along, because a lot of running injuries involving the calf muscle will often involve the soleus rather than the gastrocnemius. And as we'll find out as we go along, there are other muscle groups that play their role in sort of contributing to this type of an injury. So keep soleus in your mind. It's very important. So that's established, the calf muscles and what they do, how they work, and how they help us in running. Now let's look at some of the causes of why the calf muscle might become injured. Now the primary cause, and this is generally true of a lot of structures in our musculoskeletal system, whether it's muscles, tendons, ligaments, bones, is overtraining, and that's too much too soon. So if you're pushing your calf muscle beyond its safe zone of tolerance, if you're pushing too hard, too far, too soon, then you're likely to get an injury there. And obviously, again, like all these structures in our musculoskeletal system, our calf muscles have a tolerance to load. It's going to be less in a beginner runner, and and able to take more strain in an experienced runner, a master's runner. But in both cases, if you push that muscle beyond its safe zone of tolerance too quickly, then you're going to get an overload, you're going to get a breakdown of the structure, and you're going to get an injury. So that is the primary cause, and the majority of runners who come into my practice, whether it's with a calf muscle injury or any other type of soft tissue injury, it's usually going to be because of overtraining. So the first things to think about is, is your training load, have you overdone it? And of course we want to push our systems a little bit to get stronger, to get better, but that has to be gradual, and has to be progressive, and it has to be smart, and not too much too soon. So that's the first one, and whilst we talk about tolerances, age is definitely a factor. Now, I am an older runner, and so the evidence suggests that as we get older, our calf muscles become less able to tolerate load and stress, so they're more vulnerable to injury. So unfortunately, the older you are, the more likely you are to get this type of injury, which means that and I'm jumping ahead a bit, we need to give more attention as older runners to strength and conditioning to make that muscle as strong as it possibly can be. So going beyond overtraining and age, the next important factor is if you have a history of injury. So if you've injured your calf muscle before in the past, then you're much more likely to pick up another injury in the future. Now, why might that be? Now, probably one of the causes is insufficient rehabilitation. So if you've had an injury, maybe you've just done what a lot of people do, is they just rest for a week or two and then come back to running when it seems to settle down. But you still have weakness, maybe scar tissue that's built up around the injury. Its functional length and its ability to manage load has shrunk. And at some point, you've got that sort of weakness that's left over from the old injury. You're much more likely to overload it again and cause another injury. And this is ever so common. Again, people come in to see me and they have this sort of repeating injury that won't go away. And again, jumping forward, but that's when we need to look at strength and conditioning in a bit more of a robust way, if that makes sense, really giving attention to strengthening up that area. And then finally, a factor that's often overlooked is, obviously I'm talking about the calf muscle, and I'm very much isolating it, zeroing in on it as a group. But you can't isolate the calf muscles from the rest of the body. We are whole beings, head to toe. Everything affects everything else to a certain extent. And as runners, we need to be balanced and strong all the way up and down. And if you have a situation where the muscles that support the function of the calf, so we talk about the hamstrings, the glutes, the structures around the foot and the ankle, the quadriceps, all those important prime movers and stabilizers, if they're dysfunctional in some ways, then that's going to put greater demand on the calf muscle. Greater demands, then we're much more likely to overload it. So again, it's important to make sure that we're strong and balanced all the way up. And when I'm looking at a calf injury, I'm looking at the hamstrings, the quadriceps, the foot and ankle stabilizers, the glutes, all those muscle groups, to see if there's anything there that might be contributing. And our final thing to consider is running form and technique, and we'll get onto this in a separate video. But if you're more of a forefoot striker, which is often recommended these days, so the load is on your forefoot, and you're kind of hanging off your heel's in space. And the more aggressive a forefoot striker you are, the more you're sort of hanging off the heel. In some cases, maybe your heel's not even touching the ground. Then you have very high loads going through the calf muscle with that running technique. And the further you run, the higher, the more the demand, the higher the loads. Now, obviously, there's a lot of good things about forefoot striking. You tend to shorten your stride, so you get a better cadence. There's less strain on the knees. But you're going to put more strain on the back of the leg, on what we call the posterior chain, going up the calf muscles up to the hamstrings. There's no such thing as a free lunge. You're just moving the forces elsewhere. You're going to be hanging off that calf, and that high demand on the calf, particularly over distance, and the more aggressive your forefoot striking is is going to increase perhaps your risk of injury there. So if you're shifting to a forefoot striking pattern, if you've been advised to do that, that's fine, but make sure you've got the strength in your calf muscle to tolerate that and make your transitions gradual. Anyway, so there we go. That's looked at the calf muscles themselves, what they are, what they do, and some of the causes of injury. In the next video presentation, I'll be looking at the symptoms of calf muscle injury. How do I know if I've got one? And what you can do to deal with it if you're unlucky enough to get an injury, and some of the prevention measures that you can take to avoid getting an injury in the first place. So I hope you found that helpful. I'll leave it there. Take care, and I will talk to you again soon. Bye for now.